Have you ever been jolted awake by a sudden, sharp cramp in your calf or foot? You're not alone. Leg cramps, famously dubbed Charlie horses, affect a large majority of older adults, stealing restful nights and causing daytime discomfort and worry. You may have heard the common idea that cramps just happen because of aging, but the real story is far more hopeful. Many everyday habits and conditions feed these cramps without you realizing it. And with small shifts, you can often reduce or even stop cramps from ruining your days and nights. I'm Dr. Thomas Carter. With over 30 years of experience working with seniors, I've learned that understanding your body's daily rhythms and needs is the key to relief. Today, let's dive deeply into the 6 most common everyday causes of leg cramps for seniors, explain why these factors matter, and show what you can do today to start easing the pain and regaining comfort. 1. Prolonged immobility and sedentary behavior. You may spend many hours sitting, watching television, using the computer, reading, or simply resting. For seniors, immobility for long stretches is common but can be deceptive in its effects. Why it matters? When muscles aren't moving regularly, circulation slows. Blood flow carrying oxygen and nutrients diminishes in the calves and feet. This leaves muscles tired and prone to cramping. Waste metabolites like lactic acid build up, irritating muscles further. Also, muscles stiffen due to lack of use, making even small movements trigger painful spasms. Science insight. Studies confirm that seniors seated longer than 2 hours without movement have stiffer calf muscles and a significantly higher risk of nighttime cramps. Actionable advice. Set a timer as a gentle reminder to stand, stretch, or walk for a couple of minutes every 30 to 60 minutes. Incorporate micro activities such as ankle circles, toe flexes, or standing marches during TV commercials or phone breaks. Regular, light physical activity enhances muscle tone and promotes circulation. 2. Dehydration and electrolyte imbalance. As we age, our thirst sensation becomes less acute. Many seniors unintentionally underhydrate, leading to concentrated, thicker blood that flows less freely. When combined with electrolyte loss, this is a prime recipe for muscle cramps. Key electrolytes, potassium, calcium, and magnesium, minerals crucial for muscle contraction and relaxation. How medications affect this. Common drugs, including diuretics for blood pressure and some heart medications, increase fluid and mineral loss. Others, such as laxatives or some antidepressants, can also disrupt electrolyte balance. Warning signs: dry mouth, dizziness, excessive thirst, frequent urination. Simple steps. Sip water steadily through the day, not just when thirsty. Add potassium and magnesium-rich foods into your diet: bananas, leafy greens, nuts. Speak with your doctor about testing electrolyte levels or safe supplementation. Fun tip: infuse your water with fresh lemon, cucumber slices, or mint to make hydration a tasty habit. 3. Poor sleep positions and nighttime posture. What you do while sleeping matters more than many realize. Curling legs tightly, pointing toes downwards, or tucking feet under covers compresses muscles or reduces circulation. Result? Nerve signals misfire, blood flow slows, and muscles fatigue, culminating in cramps that jerk you awake. Research snapshot. Sleep studies in seniors showed that simply adjusting sleeping posture, keeping feet neutral, and using pillows to align legs reduced cramp frequency by over 40%. Actionable advice. Try sleeping with a pillow between or under your legs for support. Before bed, gently flex and stretch your calves and feet to loosen muscles. Avoid tight socks or bedding that bind your legs and feet overnight. 4. Sudden, intense activity without preparation. Many seniors enjoy bursts of gardening, walking, or household chores after periods of inactivity. But jumping too quickly into intense activity without warm-up or hydration can overload muscles. Why this matters? Cold, stiff muscles combined with sudden exertion experience microscopic damage, inflammation, and fatigue, leading to cramps. Good practice? Warm up with slow, gentle movements for 5 to 10 minutes before moderate activity. Stretch key leg muscles afterward and hydrate well. Pace yourself. Several short, consistent activity periods beat one big push. Remember, your muscles appreciate consistency and gradual progress over sudden sprints. 5. Wearing restrictive clothing or footwear. Tight socks, compression sleeves worn incorrectly, shoes with poor support, or restrictive clothing can constrict blood vessels and nerves in the calves and feet. The downside, restricted blood flow reduces oxygen delivery, while pinched nerves increase risk of involuntary muscle contractions, aka cramps. Helpful tips. Choose well-fitted shoes with arch support and cushioning. Avoid tight socks that leave deep indentations or elastic bands wrapping your legs and feet. When resting, prop your feet slightly elevated to encourage circulation. Clear, loose clothing is often underrated but crucial for muscle health. 6. Underlying chronic conditions and medications. Common chronic illnesses among seniors like diabetes, peripheral artery disease, thyroid disorders, and nerve conditions exacerbate leg cramps. They often impair blood flow and nerve signaling. Additionally, medications such as statins, blood pressure pills, or diuretics can cause or worsen cramps as side effects. What can you do? Maintain regular follow-ups to control chronic conditions effectively. Share your cramp experiences with your healthcare provider. Medication adjustments or additions like magnesium supplementation might help. Don't ignore persistent, severe cramps. They can signal circulatory or neurological issues requiring specialized care. Bonus, emotional stress and anxiety. Often overlooked, mental stress tightens muscles and increases neurological sensitivity. Poor sleep from anxiety amplifies muscle fatigue and reduces repair. Action step. Develop relaxing routines, deep breathing, mindfulness, or gentle evening stretches to ease muscle tone and calm nerves. Busting common myths. Cramps are just old age and can't be fixed. Reality, most senior cramps respond well to simple daily habit changes. Supplements alone cure cramps. True relief usually comes from a balanced diet, hydration, movement, and good sleep. Supplements are a helpful part, not the whole answer. Ignoring cramps is okay. Cramps often worsen without intervention and reduce quality of life significantly. Your simple daily plan to ease leg cramps. Move regularly, stand, stretch, walk briefly every hour. Keep hydrated with water infused with fruits or herbs for flavor. Eat foods rich in potassium, magnesium, calcium daily. Check clothing choices. Opt for comfort and good fit. Sleep in positions that keep legs relaxed and circulation flowing. Manage stress and medications thoughtfully with your doctor's guidance. Share your journey. Have you discovered habits or small changes that reduced your leg cramps? Or are there tips you want to ask about? Please share your stories or questions in the comments below. Your experience could spark hope and healing in others. Thank you for spending time with us today. If these insights helped you better understand and manage leg cramps, consider sharing this video or information with your loved ones. Join our welcoming Health Hub community by subscribing for more practical advice tailored to real senior lives.